Hi everyone, welcome back to the channel. I am Drew with Let's Talk Something. Today I'm going to be giving an update on the outbreak. And oh boy, everything is just so crazy right now. I went to my supermarket right in the corner, my local supermarket right here on the corner, and it was crowded. I decided I was not going in at that point. I later returned to find empty shelves. Empty shelves. People is just going crazy. The guy who works the deli at the supermarket was frustrated and overwhelmed. He was telling me what was going on, and it sounded like he wanted to cry because he was the only one back there. Usually, there's other people there during the day, but I guess since people was working and they weren't able to shop earlier until they got home from work. So now in the evening when he's there and he's by himself, all the people who went home that does the cook food is gone and he's there by himself. The rush just came in, and he was telling me people is buying 10 pounds, 20 pounds, 30 pounds, 40 pounds, 50 pounds of cold cut and cheese at a time. He said they're just going in. I literally had one person in front of me had to wait 15 minutes. 15 minutes. 10 pounds of salami and turkey and you name it. Roast beef and all these cold cuts and cheese, and he was just overwhelmed. And this is something that's like right now common. This outbreak is causing chaos. And like I said before, I understand why YouTube is doing what they're doing and suppressing YouTubers from putting out news about the outbreak. And I understand because they have the people that does the fake ones intentionally, or they put out misinformation. But in this case, I don't agree with it. I don't agree with it now because the media themselves, the big giants, they're putting out information. They have all these doctors coming saying this and saying that, and it's so much information, and every time it's something different that contradicts the other one, and there's so much information going on. The media themselves, who's telling people that they should calm down and don't panic, is the ones that's putting out the panic. They're the ones that's giving everyone, putting everyone in this position that they feel like they have to panic. Right here in Fox 5 News, right here in New York, every day they have some doctor. They have Dr. Oz. They have someone who is a scientist who specializes in infectious diseases. Multiple times I've seen multiple interviews on different channels with some expert. Now, don't get me wrong here. I mean, I like Dr. Oz, but I want to know when did he become an infectious disease expert? When did he become an infectious disease expert? Because he's given a lot of information, but his information is different from what I'm seeing at these press conferences that the CDC is holding, or the mayor or the Blasio is holding, and they're at and having experts there, and it's like it's complete different things being said. And I said it before in one of my previous videos how they're saying, at first they were saying that you will show symptoms in 2 days. Then it went to 8 days. That was at 14 days. And somewhat a gentleman, I can't remember his name, that actually specialized in infectious diseases, said they're actually basing this stuff on the SARS and the flu and stuff like that. They don't know what this version of coronavirus is like. Even when they say, oh, in the summertime in warm weather, it's not going to spread as much. Because Dr. Oz was just on the news this morning. Actually, Friday morning, they had a whole special with him. And he said, oh, it's going to go down in the warm weather. And he sounds so sure of himself. Now, I'm hoping what he says is true. But according to this guy that specializes in this, he said there's no evidence of that. They don't know. It's just speculation. At this point, it's speculation because they don't know. Even when they talk about it lasting, you can go 2 to 14 days before you even start seeing symptoms. That is just a guess based on previous based on the SARS. That's data from the SARS. It doesn't mean that this one is the same. The same thing when they say it can live on surfaces for 2 to 3 days. This guy was also saying that is just a guess. They got that from France, where France didn't even publish that themselves. It's just something they came up with, but there was no way for them to know exactly if that is true. And as I said before, they keep saying wash hand. That's the odds. Wash hand. When do we wash our phones? You wash your hand, you sanitize your hand, and then you go right back to touching that phone. So right now in New York, it's crazy. Right now, my son's school sent a letter home stating that they will be closed for 2 weeks, that they will not be returning back to school until March 30th. They said because every day they've been 400 kids absent from school. So that's why they made the decision to just shut it down for 2 weeks. Because they understand how parents are feeling. And parents are feeling this stuff because of what the media is pushing out there. So the fact that YouTube is stopping because they don't want misinformation or false information, and they're only allowing partners of these media outlets or the media outlets themselves to put stuff out on YouTube without compressing it and demonetizing it. It's ridiculous because they're the ones who's doing that. They're the ones who have a different doctor every day giving a different story. I literally watch all these doctors give a different story. The CDC story is different. Health department story is different. Dr. Oz story is different. And I hope it's true that it doesn't spread. But then you also have countries that are hot, but that has the coronavirus, but it's not widespread because a lot of them acted when this thing started. When they were informed about it, they acted right away. They start shutting down their borders. They start doing stuff like that. They start screening. Okay, my country of birth started doing that right away, even before there was a case. Even before they shut down borders, they started testing people coming in. They started doing stuff like that. They started doing that. Donald Trump tried to play it off like it was nothing. Like it was nothing. He wasn't worried about it. It was Obama's fault. It was a hoax by the Democrats to win the election. He didn't even jump on it as soon as he would. And then today, this Friday afternoon right here, I had to literally, on my way out the door to go pick my son up, turn on the TV and seen a press conference and had to literally watch on live TV Mike Pence sucking Donald Trump's dick. I saw Mike Pence suck Donald Trump's dick on live television. How this man over there is saying, "Thank you, Mr. President, for acting immediately and swiftly." My ass. Because that is not what happened. That did not happen at all. This man waited. He should have started right away. Don't you see what happened to Italy? And I'm glad. That's why I said people. People should not pay attention to this national stuff and pay attention to your local government, because if the local governments didn't start acting right away and they were acting like Donald Trump, we would have been much worse off than we are. And this is not a I'm not trying to knock on Republicans or Democrats, because quite frankly, I don't trust both sides. I don't trust both sides. I think they're all in the in their positions for themselves, for their own interests. So this is not me siding with Democrats or Republicans. This is not politics to me. I don't care about that. These politicians can't get over themselves, especially in crisis. They need to stop this and do what's right for the people. For the people. Not for yourself. No agendas. No agendas. Store shelves are literally empty. It's crazy out there. People are literally panicking. Now, Dr. Oz say, well, they shouldn't take the kids out of school because, because no kid under 10 dies from this coronavirus. Yes, but you also keep saying people with underlying issues are more susceptible to die from this thing, which is true. You do know you have kids who have asthma, very bad asthma. Okay, one of my niece has very bad asthma, so she can't afford to get this disease. Okay, I have a cousin who has cancer. Well, right now he's about 19 now. But if he had cancer, he's diabetic and all that stuff his whole life. So imagine then, if this was when he was 6 years old, when and all that stuff, he probably wouldn't be here right now. If he contracted this disease. So there, you do have kids who do have asthma, very bad asthma. So that's an underlying issue, because they mentioned that before. And the shortness of breath. Somebody with asthma can't be having no shortness of breath. You have kids that are diabetic. So even though I understand why you don't want to close schools, because a lot of these first responders and healthcare workers, hospital employees, stuff like that, and people like that have kids too, and they can't afford to be home because we need them to be doing their jobs. I'm gonna read an article here from CBS that I just read about. I'm gonna read this here right now. Let me find it here. The vast majority of New York City public schools remain open Friday. Yes, it did. Some schools chose to have a half day. The school right across the street from me had a half day, and the teachers was out of there so early. By 12 o'clock, those teachers were gone. The debate as to whether that's wise is playing out amongst parents picking up school kids in Lower Manhattan. Mayor de Blasio is feeling the pressure to shut them down. Overall, school attendance was down 68% Friday, said Mayor de Blasio. Now, remember I just mentioned my kid's school decided to shut down for 2 weeks because parents who are panicking was not sending their kids to school. They said they were getting absent kids on the daily of 400 plus on the daily absent from school. My son was telling me a lot of kids wasn't even for the whole week wasn't even on the bus that is usually on the school bus. De Blasio said his overriding goal is to keep schools, mass transit, and healthcare systems going. He says the decision to shut any of them will impact others. And he especially wants to protect the healthcare system. We have to protect our healthcare system at all costs. He said if schools were closed, kids would still be kids and find ways to run around outside, which raises its own concerns. He urged people to read the CDC guidelines for school closures. De Blasio said he thinks it's an illusion to think the school system could be shut down for just a week or two aimed a crisis. He said he thinks it's more likely if schools were shut down, they would wind up shut down for the entire school year, if not calendar year. De Blasio asked if children manage to stay in isolation for a week, does anyone think they would remain in isolation for a month or longer? He said the same could be said about their parents who might have to stay home to care for them. No, I completely agree with that. I completely agree with that. Kids will find a way to run around. And then what are you going to do? Are you going to shut it down? And this 2 weeks is not going to really do anything. They're still going to go back to school in 2 weeks. And it's still out there. This mass hysteria that's going on. And I said, it's the media is the one that's pushing out all this stuff. And then they're telling you not to panic, not to panic. But they already made you panic. And why don't people act like this with the flu? Because the flu is something that kills a lot of people every year. At least when I looked it up, it says, I could be wrong, but that's the information I got when I searched it on Google. It came up 12,000 yearly in the United States. Worldwide overall, in all the years combined, 20 to 50 million people has died from the flu. Combined in all years. So, and that is just an estimate. It could be more, it could be less. Someone said people are just running and panicking and having this excitement and this anxiety over this because it's something new, it's something they don't fully understand, and because there's no vaccine, but they have a vaccine for the flu. Which I was told is not so much the vaccine for the flu is not so much about not getting the flu so you don't die from the flu and spread it. So, but people still opt not to get the flu shot. Okay? My girl is one of them. She does not get the flu shot because she thinks that the flu shot is supposed to not give her the flu, and every time she gets the flu shot, she gets the flu. So she doesn't get her shot. And for years, I didn't get my shot. And not because, for me, it wasn't because I didn't want to get the flu shot or I believe it didn't do anything. It's because I didn't have health insurance and I never thought about it. And I usually get the flu and it's gone in a couple of days. Maybe the most I've ever had it for is a week. And usually when I was growing up, I was always told, because I have one of those Caribbean, I'm from a Caribbean family. We were always told to just move around and sweat it out. And usually that would work, except for 1 year. That didn't work. I had the flu and I went to work. Never told my boss anything, nothing. I thought I was going to be like all the other times I had flu, I worked and sweated out. But for some reason, it must have been a different strain of flu or whatever the case may be. That did not work. I worked, and the more I worked and the more I sweat is the more dizzy and the more weak I felt. To the point where I was just so weak that I couldn't work. I started sitting down. Lucky for me, which was surprising, because that boss was so mean, and I thought she wouldn't have even allowed me to go home. She told me to go home and take the week off. I was so surprised and I was so happy. I went home and sleep, drink a lot of fluids, and I was better. I think last year was the first time I had the flu shot in a long time. I haven't had the flu shot since I was probably in high school because they required me to do that. So that was a very long time I haven't had a flu shot. But a lot of people opt out of getting flu shots, and they have a vaccine for that. So people are running and panicking for this thing because there's no vaccine and it's spreading so fast. But when there's a vaccine for it, will they act the same way? Will they say, "I don't want my kid to get it. I'm not gonna get it because it's not going to do nothing. I get the shot and I might still get the virus anyway." People need to stop and think as well. If it's there and it's get the shot, but I can't tell you what to do. You have to do that for yourself. You have to know. You got to take your own risk. Let me read some more of the article. Everyone's concerned and there's a lot of anxiety, de Blasio said. My strong belief is that if the schools weren't open, the children would go all over looking for things to do. You would need you would not see a pristine quarantine. And that is true, but I don't know what I know because I would never let my kid run around the street on their own. No, you're gonna find something to do in this house. You're gonna read a book. You're gonna go on that ABC mouse. You're gonna do something. You're gonna find we got ton of toys for you to play with in here. You're gonna find something that. But I also don't believe kids. I want my kid not running around playing outside. Because they will get bored no matter how many toys, books, video games you have. All non-educational school activities have been canceled, de Blasio said. He also said schools may move breakfast and lunch into some classrooms in order to help social distance. If a variety of steps will be taken to support everyone in the school community. The United Federation of Teachers on Friday joined some parents, school staffs, and elected officials calling school closures a logical next step. Now, for me, that'll be a step if New York is so much. Right now, New York is over 400. It has reached over 400, I believe, in New York. But it's mostly in the clusters. So that's where you're seeing this a majority of this is the clusters, not really. I believe in the city, which would be because I don't really understand what they call the city. Sometimes when they say the city, they're just talking about Manhattan. And recently, when they keep saying now, when it's for this virus, when they say the city, they're talking about Queens and Brooklyn and the Bronx and Manhattan. So it's all confusing to me. I never really understand when they say the city instead of just saying the state. We do have 5 boroughs here, for crying out loud. So between Brooklyn, Queens, the Bronx, and Manhattan, there are 95 cases total. The rest are, from what I believe and from what I heard in the news, is part of these clusters in like Westchester. I think that's where it's spreading more because of these communities, these close knit communities. Nancy Pelosi and Donald Trump has reached a deal, and they're gonna sign. Hopefully, I think it was already passed in the House, and they're just waiting for the Senate to pass it. And the president said he will sign it as soon as it comes to his desk. I believe I forgot what the amount is, or I think it's 50 billion that will go into all these testings, and I think they're allowing. I think they're now also allowing the states to do private testing and so on. And I believe they're gonna pay you up to 2 weeks or something like that. I'm not sure. You can look into this. I wasn't really paying attention because I've been hearing about this all day. Like you can flip a channel without hearing about this thing, and I'm a person. I get to the point where I get annoyed and I don't want to hear it anymore. And especially after I saw Mike Pence sucking Donald Trump's dick on live TV, I couldn't do it anymore. I just couldn't do it anymore. I just couldn't do it anymore. But that is just a quick update on this outbreak. If I even said the name in here, I already screwed up, but hey, is what it is. Hopefully this video gets seen. If you see this, please subscribe to the channel. Leave a like, give it that thumbs up. Hit that bell notification icon. Leave your comments down below. I am Drew again. Let's talk something.